Namaste दोस्तों and welcome to today's explainer. I'm so pumped you're here because आज हम एक ऐसे टॉपिक पर बात कर रहे हैं जो literally हर जगह misunderstand किया जाता है. You know how people casually joke around, right? Like, oh, my desk has to be perfectly clean. I'm so OCD. Well, today we're going way beyond those stereotypes. आज हम exactly unpack करेंगे the real clinical psychology of obsessive compulsive disorder.
Tell me honestly, ever checked the front door twice before going to bed? Sabne kiya hai, right? We've all double-checked the lock or maybe the gas stove. And doing that once in a while? Completely, perfectly normal. But here is the absolute game changer. While you or I can just check the door and walk away, for someone actually living with OCD, it is a relentless, uncontrollable loop. It's a cycle that severely impacts their daily efficiency, their work, their social life. They're basically trapped.
So here is our roadmap for today. Number 1, समझो OCD actually क्या है. 2, who gets OCD? 3, the specific thoughts and compulsive actions. 4, the core themes. And 5, why does it happen?
Okay, चलिए शुरू करते हैं पहले सेक्शन से समझो OCD क्या है. Let's get straight into the true academic definition. At its very core, OCD is a severe anxiety disorder. And, the real heartbreak here is the internal conflict. The person suffering knows, they absolutely know, that their recurring thought or behavior is completely irrational. It doesn't make any sense to them either. But despite knowing that, they are completely helpless. They literally can't control the thought or just stop the behavior. It is just so mentally exhausting.
So it essentially comes down to two main components. On one side, you've got obsessions. ये वो irrational thoughts हैं that just keep invading the mind over and over, creating intense mental distress. And on the flip side, we have compulsions. This is performing a physical task repeatedly. Psychologically speaking, the compulsion, the action, is actually an unconscious attempt to soothe or prevent the massive distress caused by that obsessive thought.
ये हमें सीधे लाता है हमारे सेकंड सेक्शन पर. Who gets OCD? आखिर ये होता किसको है? Let's look at the actual demographic data.
Back in the day, the medical community honestly thought OCD was super rare. But modern statistics tell us that 1.6% of people currently have the disease. Now, 1.6% might sound kind of small on a chart, but if you map that onto the global population, that is a massive, massive number of individuals suffering silently right this very second.
And the numbers get even bigger when we look at lifetime risk. About 2.5% of people will actually experience this disorder at some point in their entire lives.
Let's break down the risk factors a bit. The data shows us that divorced and unemployed individuals are actually at a higher risk here. Now, typically the onset begins in adolescence or early adulthood, but it can begin in childhood. And here's the tough part. When it does start in infancy or childhood, the academic literature shows it's relatively more severe. Interestingly though, the onset is usually gradual. It slowly peaks into an acute phase and then kind of decreases in intensity over time.
Now here's a really unique fact. If you look at most anxiety disorders, there's usually a gender skew. But with OCD, there is absolutely no difference in proportion between men and women. It strikes equally across the board. All right, moving right into section 3, thoughts and compulsive actions. Prepare yourself a bit because we're going to touch on some intense clinical realities to really grasp what patients go through.
You might be wondering, do people only get the thoughts or do they only do the actions? Well, it turns out it's incredibly rare to just have one or the other. Like 90% of people with this disorder are stuck dealing with both simultaneously. The thought triggers the immense distress, and the behavior is just a desperate attempt to fix it.
The contrast between the mind and the body in these cases is just staggering. The thoughts themselves are terrifying, deep fears of getting infected, accidentally harming yourself or a loved one, or just sheer panic about family safety. And to fight those thoughts, the actions become extreme. Guys, we aren't just talking about washing your hands before dinner. We are talking about patients scrubbing their hands with soap until blood literally comes out of their skin, or checking a door lock so many times at night that they just collapsed from exhaustion. The physical and mental pain is incredibly real. And this brings us to section 4, the core themes. When you have symptoms ranging from aggressively counting numbers to an extreme fear of poisoning, you really have to ask, how on earth do psychiatrists connect these wildly different behaviors together?
Well, academic research clearly proves that despite these massive variations in symptoms, there is a fundamental psychological compatibility linking all of these patients. They all share the exact same underlying architecture of anxiety.
You can think of it as the anxiety loop. Step 1, it always starts with a strong fear of some inauspicious or terrible event. That immediately leads to Step 2, severe, unbearable anxiety. Then comes Step 3, the repeated compulsive action. The person performs this ritual because for a very short, fleeting moment in Step 4, it actually reduces their anxiety. That compulsion? It's basically a desperate, temporary coping mechanism for a completely unrealistic risk assessment.
Okay, so we know what it is and we know how the loop works. Section 5. Why does it happen? Lekin aisa hota kyun hai? Let's uncover the psychosocial causes.
To do this, we're going to ground our explanation in the academic frameworks established by prominent psychologists like Carson, Butcher, and Minica, who pinpointed 5 key psychosocial causes.
Here's our quick roadmap for this final part. We're exploring the psychoanalytical view, the behavioral view, prepared attitude, the role of memory, and finally, repressed thoughts.
First up, the psychoanalytical viewpoint. This theory suggests that deeply painful childhood experiences, like, say, overly rigorous hygiene or toilet training by strict parents, can be traumatizing. So a person might unconsciously use OCD in their adult life as a psychological shield. It's literally a way to prevent those deeply suppressed, painful memories from ever bubbling up to their conscious mind.
Next, we have the behavioral viewpoint, championed by O.H. Moore. And this is fascinating because it shows how learned behavior actually mutates. Think about it. A child is taught that touching dirt brings infection, but washing hands removes that infection. Fast forward to adulthood, and through conditioning, this translates into, I feel intense fear, hand washing removes infection, therefore, hand washing will remove my fear. The physical, everyday act of washing literally mutates into a tool to wash away psychological terror. Then there's biology and memory. Prepared attitude is this evolutionary idea that humans are just biologically wired to avoid danger and dirt so we survive. OCD is basically that exact survival instinct dialed up to an extreme, completely irrational level. And compounding this is the role of memory. Research actually shows that many OCD patients suffer from a tragic lack of confidence in their own memories. They constantly recheck the gas stove because their brain absolutely refuses to let them trust that they already did it.
Finally, we arrive at the effects of repressed thoughts. And I want to leave you with this really powerful, kind of heartbreaking paradox. Usually, we try our best not to think about things that scare us, right? But research shows that when people try to suppress frightening thoughts with extreme conscious effort, those exact thoughts bounce back with double the frequency. Extreme conscious suppression literally feeds the obsession. The harder you fight the thought, the stronger the OCD loop becomes. It is a wildly fascinating paradox of the human mind. Thank you so much for joining me on this explainer today, Dostone. Keep questioning and keep learning.